I met a girl today and apparently she cannot have a child anymore.
Oh my, how old is she?
She's about 23 years old. So what happened is, when she was about 12 years old, life and everything, she became sexually active and she had multiple sexual partners and never used a condom with any. So along the line, she got pregnant, and within her pregnancy, she noticed she had HIV. So after giving birth, she became depressed and had low self-esteem. She decided to change the color of her skin. She started using steroids and injections. So 2 years after, she noticed that whenever she had sex, it was always painful. She was bleeding. Sometimes she will miss her periods, or her periods can come 3 or twice in 1 month. So she said to consult. So she saw a doctor and they gave her some drugs, but the symptoms didn't subside. So she said to see a gynecologist. The gynecologist reviewed her and told her that she had cervical cancer stage 4 and that she can never have a child again. And I was like, cervical cancer is actually something. It's something people need to know about, and it's very sad. So let's talk about cervical cancer. So what's cervical cancer? Cervical cancer, as the word states, it's cancer of the cervix, and cancer is simply the uncontrolled proliferation of cells of a particular area. So there's uncontrolled proliferation of cells of the cervix, and cervical cancer is the 4th most commonest cancer in the world and the 2nd most commonest cancer in Cameroon. And we have about 2,700 women are diagnosed of cervical cancer in Cameroon every year, and about 1,700 of these women die of cervical cancer in Cameroon every year. And cervical cancer is usually common within the age range of 45 to 55. And note you be, cervical cancer only occurs in women because men don't have a cervix. So only those who have the organ can have the cancer of the organ. So this cancer only occurs in women.
So cervical cancer is caused by the human papilloma virus. This virus has over 170 different strains, and of these 170 different strains, 4 are said to be cancer causing, meaning they are oncogenic. These 4 are human papilloma viruses 16, 18, 31, and 33. Out of these 4, 2 are more common in our area, which is human papilloma virus 16 and 18. Note you be, so people living with HIV virus are 6 times more likely to develop a cervical cancer.
I just want you to know that human papilloma virus doesn't only cause cervical cancer. It can cause anal cancer, cancer of the vagina, cancer of the vulva, cancer of the penis, and as well esophageopharyngeal cancer. So HPV can also cause or can also infect male people. For the risk factors to cervical cancer, related to the story I just told you, the very first risk factor is being a woman. When you're a woman, you have a cervix, so definitely you can have cervical cancer. The second is early sexual intercourse, where you begin having sex at a very, very early age. The next is where you have multiple sexual partners, where you give birth at an early age, where you give birth many times, when you're smoking, when you have poor genital hygiene, when you also use prolonged contraceptives, and when you're also immunosuppressed, relating the same thing to the story I told you, where you use steroids or you have your HIV positive.
Cervical cancer can be transmitted via sexual intercourse. Patients with cervical cancer usually are symptomatic, but if you do present with symptoms, they usually are abnormal vaginal bleeding, prolonged menstruation, pain during or after sex. We have vaginal discharges, urinary retention, urinary incontinence.
For the diagnosis of cervical cancer, there are a lot of things you're supposed to put in place first before you can diagnose cervical cancer. Firstly, the clinical presentation of the patient. Depending on the signs and symptoms, as already enumerated, you can start thinking of cervical cancer. The next thing, there are a lot of screening tests you can do. The first is VIA, which is visual inspection with acetic acid. You can also do a VILI, which is visual inspection with glucose iodide. If you don't want to do that, you can do a pap smear, which is one of the most commonest screening tests you can do for cervical cancer. Another one you can do is a colposcopy, which is a visualization of the cervix with a lens. And the last of all is biopsy.
The complications of cervical cancer are vesicovaginal fistula, kidney failure, metastasis to the lung, liver, or bone. For the management of cervical cancer, it cannot be treated, but it could be supportively managed by chemotherapy and radiotherapy.
For the prevention of cervical cancer, the very first thing is getting vaccinated, and getting vaccinated at an early age. That's between the age of 9 to 12 years as a girl. The second is regular cancer screening. I gave 3 methods by which you can get screened for cervical cancer, which was the VIA, VILI, and the pap smear, which is the most common. And the last but not the least is to learn about it, get knowledgeable about what cervical cancer is. Inform yourself, inform your sisters, and share this video to prevent cervical cancer.